So we're here today to talk a little bit about pretty much what IVF is the shots. Lots and lots and lots of shots. So luckily we're into our second round of IVF, which means we already have the frozen embryos, so we don't have to do the egg retrieval. The egg retrieval I thought was the hardest part because it's multiple shots in your stomach. Do you remember that pen?
The pen?
The Gonal F pen. That thing is not fun. So luckily we don't have to do that this time.
I don't have any of those.
All we're doing is Lupron right now, and then we're going to get to the progesterone and oil when we get a little bit farther into our treatments. But Kyle and I wanted to talk to you today about kind of tips and tricks and everything we've learned along the way. So,
kind of what our process is and what works for us, what works for you, and makes it easier on the two of us to get everything ready to go.
Completely. And I will say, I think if your husband is willing to do it, it's awesome if he would do your shots. First of all, no way in hell I'm doing my own injections. Like, not happening. And second of all, I mean, obviously I think that it brings you closer together. It makes it your process together. And he's a really, really, really good shot giver. Like, really good. So,
Not sure where that comes from, but I learn, I listen, I watch.
Talented at everything, guys. So first of all, I think the most important thing is to definitely not psych yourself out, because going through the first round of IVF, the needles weren't even that bad, but in my head I made them a lot worse than what they were. So just realize and take a deep breath and know that, like, look, I'm a huge wuss, so if I could get through this, you can get through it. And then another thing I found really important is that you let Kyle or your injector set up all the medicines kind of on his own. So do you want to talk about that?
Well, you want me to do it, why?
Because, well, first of all, if I watch the process, I get nervous and I agitate somebody by constantly asking him questions. And
She doesn't believe I can get the right amounts and into the syringe and make it correct.
I mean, more or less, I'm just really nervous about the process.
OCD.
So I was taking it out on him. So he made me go sit in another room, which for myself and for him, I think went a lot better.
I think you also psych yourself up a little bit too.
Yeah.
Like you're so nervous that then it's like the nerves, like you're just shaking before the shot happens versus just go relax, chill out, grab a bag of ice, and I'll be there in a second.
Yeah, completely. And one thing that Kyle always did, especially when we were doing multiple injections in one night, is he got all the medicines ready even before he came to me. So then it wasn't like he would do one and then have to go back and get the next one. So it was just like boom, 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 boom. Mm-hmm. And I think that that was really helpful.
Absolutely.
So then you want to talk about timing?
Timing, sure. Yeah, I mean, I think what works best for any family or any couple that, for us, it's more later on at nighttime. Having that set time every single day, hitting the same shots all the time, is what kind of the doctor instilled in us and making sure that we were on time with everything. So we vary here or there, maybe 30, 45 minutes or so. But other than that, the biggest thing for us was kind of later at night after Brexton's gone to bed. We started a few with him to kind of show him what all's going on in the process of all that. But once we kind of get him down and put him to sleep, then we can go after getting the shots done. So typically it's between 9:45 at night, and that's kind of when we set on.
Yeah, you have a good hour window, but I definitely find it best to kind of just make it part of your routine so that you're not forgetting. And then also when it does come to multiple medicines and shots and whatnot, last round I made a chart, and I thought that that was really helpful because, you've got a lot going on in life and you suddenly become like pretend doctors, so just making sure you keep everything organized.
For us too, like if we go out or we have some friends over for dinner or whatever, it's after all of everybody's gone and we have the opportunity to just kind of do it on our own and do it ourselves rather than thinking like 4 o'clock's the right time or 6 o'clock's the right time. Then you got to pack the vials and you got to pack everything in order to go out or go somewhere, which sometimes we still have to do. If we know it's going to be a late night, we do it just in case anyways.
Yes. So while he's prepping all the medicines and whatnot, right now for the second round we're just doing the Lupron shot, which I think is like really easy. Little side note that the nurse told me is totally normal. Lupron can make you a little easily agitated, Can I say it like that?
Edgy.
Sometimes you just want to strangle somebody, and it's like feels like this pent up rage, and so
She's mean.
I'm not mean to you. Okay, you get a little feisty, so just know that that's normal.
It's coming.
It's normal. It's hormones. Okay, so while he's getting everything ready, this is the bottle of Lupron. It is going to look like they forgot to fill most of it up, but
It doesn't come with much because she has such a small number of milliliters that you have to do. It's only 10 units. So.
and then it goes down to 5. So don't freak out because I called the nurse the first time like, hey, they forgot half our medicine. Don't worry.
So here's your alcohol prep wipes, obviously. So you just kind of pull that out. There, set that down. Pull that out. You wipe the top of the vial, just making sure that it's clean, it's sterile, everything's good there. And then you'll pop open the mini syringe. So this is the one that Samantha likes. She's not too fond of some of the other needle sizes that come, but this one's actually okay. So it's a small needle. It's only a 1/2 inch in length. So very tiny, pretty simple for her, easy to go in. As you can see.
I'm icing right now. We find that icing the injection site, I find it's a lot less painful. But Kyle's noticed if I ice for anything over about 5 minutes, it's tougher to get in.
Yeah, think of it like a piece of steak, right? Like you pull a piece of steak out of the fridge and it's frozen, you're not going to get anything into it. So obviously there's kind of a set time frame that you've got to have to be able to get the needle in. The needle's very, very tiny, very, very small. So obviously the easier it is for it to go in, the less painful it is for you.
Right.
But you're still kind of numbing the area with the coldness so you don't necessarily feel the needle that's going in.
Correct.
So, double-edged sword, 2 processes there that you got to think about. For me, what I do is I always pull the syringe back to more units than what I plan on taking out, just because of the air process that you don't want to have any bubbles within the chamber or within the needle or anything like that. So I'll pull back to about 15 units, and then it's just got a rubber little top right here, so you go right in, and then as it's still sitting normal so you're not in the liquid making any bubbles, go ahead and push all your air out into the bottle, flip over, make sure that your needle is completely submerged in the liquid, draw out your units. Again, I draw out past the 10, but I only go to about 12 or 13 because I don't want to go all the way back to 0, which was the 15, if you think about it that way. And then I tap back the 2 to 3 units to get right at the perfect amount of 10, flip it back over, pull out. There's no air bubbles in there whatsoever. The air that you inject in here, it'll come out the top a little bit, no big deal in that. It's fine, it's ready to go for the next day.
Yep.
So that's kind of my cool tricks of the trade for what I got going on.
Let's save that one for tonight. It's not quite injection time, so I'm not going to let him inject me at the moment. Here goes that one. So another good tip is obviously with your stomach, good thing it worked, cute pink underwear. Use your belly button as the middle and switch side to side. I found that going anywhere right under my belly button for some reason really hurt. So we flip sides every night. And just try to look. Sometimes you can still see the prick, like where it's at. Don't go too close to that area. I haven't bruised at all, probably because he's a great expert injector. But yeah, so
What do you want to do?
unfortunately I'm going to stab myself twice tonight just because I really want you guys to get the full effect. So after we're iced, and then you take another alcohol wipe and just make sure you wipe the area. I'm going to just like do it lightly because I got a spray tan, so let's pretend I don't want to rub my spray tan off. So, alright, then what you do is you definitely sit down instead of standing up and you make a roll. So feel where it's cold and then roll and pinch a lot. So take over my roll.
I'm right-handed, so I'll come around this way.
So then as he's holding it, I breathe in, and as I breathe out, he sticks me. So, and I never, ever, ever look at it, nor do I want him to count, because that just makes it too much. So, deep breath in. There it is. Really, really easy. Like,
Wow.
yeah. There's nothing there. You don't really have to rub it or anything like that. So super, super simple. Here's a really interesting tip. So I heard this from a nurse once. These don't hurt. Like, honestly, those don't hurt at all. Some of the other ones, especially during egg retrieval, really aren't super fun.
Mostly because the liquid is different. This is very, very fine, very, very watery. Some of those other ones are like a gel. They're thicker, so it takes longer for the needle to get it into...
And the needle's bigger. So what you can do, so if he's injecting on this side and you happen to have a other person here, they could kind of lightly pat the other side. And a nurse once told me that if you're having like a stimulus on this side and this side, your brain doesn't pay as much attention to either of them. So if it's really bothering you, you could definitely try something like that.
Or you can just tap her on the forehead.
Yeah, maybe.
Just give some forehead taps.
Stop tapping my head. Okay, so moving on. You will, after you get through the Lupron and you're well on your way, then basically you have to get your body ready so that it thinks it's pregnant. So when the embryo is transferred in, it's ready. So these are easy. These are simply just literally patches. They're like little stickers. You peel them off and you put them all along here. And these thicken your uterus lining so that the embryo will implant into there. These are like the easiest part of the whole process.
A sticker.
What else do we have? This is an antibiotic. They just tell you to take it twice a day so that you don't get sick during all of this. I had to take it with food or else I felt a little nauseous. So that's super easy. This is something new that has come out since the first time we've done IVF, and these are lidocaine patches. So what you do, I'm definitely going to use these when we do the progesterone, which we'll talk about next. But you just peel them off and leave them on the injection site for about 30 minutes, and it should numb that whole area. So super excited about these. Once we try them, I will let you know which I like better. Mm-hmm. So then comes the progesterone and oil.
Here's the progesterone. It comes in 2 vials. This is obviously one. It's still sealed. I'm not breaking the seal because we don't need to yet. But it's the same thing. It's going to have the same look as the Lupron with the little rubber area on top that the needle will go and fit right in. And you'll have the same process with the needle.
Yeah, pulling it back.
Depending on the amount of units and depending on all that, you pull back, push the air, pull it out, make sure there's no bubbles, tap it back out, same sort of stuff, and get ready.
What is interesting, a tip that I've learned is that you can take like a heating pad or keep it in between your hands or something warm, and that will help the oil to unthicken. Is that the right word?
Mm-hmm.
Thank you. To thin out a little bit, and it makes it easier. So here's another tip that you can ask your nurse. This is the needle that they expect you to use when you're using progesterone and oil, because it has to go into the muscle.
Because it's a oil-based liquid that the needle size is bigger around, basically.
It's freaking huge.
Yeah.
Huge.
But show that.
You would never get it
It's
out.
not just the length, but it's the thickness of the needle itself.
So, because it has to go into your muscle. But I'm not that's like really big when you look at that. So I didn't need this size, and they actually said that a lot of people don't. So what I learned is that you could ask for a smaller needle, which was definite. So this is a 1-inch, 25 gauge, and this is a 1.5-inch, 22 gauge. So it will take a lot longer to administer with this, since it isn't, you can
only push the liquid out so fast.
But to me, once the needle's in there, I'm okay. It's the actual injection. So I would rather have the needle in my butt for 2 minutes versus 45 seconds, but not have to deal with this thing. So you can see when you ask for a different needle, the size comparison. There's quite a difference. Maybe put your hand on it so people could see from the background. You see that? It's a big difference. So yeah, I wish it was that one. So yeah, make sure you ask. You can ask, and they will give you smaller needles. I know I feel like I'm going to hurt myself with that.
Switching them is not that hard either. It's just a little twist off. So literally, that's it. So give me the other one.
Oh. And you'll do the same thing. You'll move the injection sites around.
Boom, done.
Yeah, the doctor will, or the nurse will show you on a graph where on your butt you can put them. Okay, so let's show them what we mean. Here, use my butt.
All right, so you're only allowed to go in the upper outer quadrant. So if you look at the butt right down the center, and then right here about the pocket line, that's going to be your quadrants. You're going to have 1, 2, 3, 4. 1, 2, 3, 4. You're only allowed to go in the upper outer. So if you use basically where my hand is here,
Below your hip.
and basically where my hand is there, below the hip bone, but before halfway through the butt cheek. So you have this much space to work with on this side.
So there you go.
Upper outer.
Upper outer. And there's tons of videos and everything. Your doctors will show you all that, but we just wanted to give you some of our little tips and tricks that we've learned along the way.
And that's with the progesterone shot, correct?
Yes.
Right. And so when you're done doing the progesterone shot, you actually have to massage the oil for a few seconds, 10, 15 seconds to kind of, you make sure it's in there and gets in there, and because it's going into the muscle, so getting it to disperse. That was another one of their tricks of the trade to tell us.
Yeah, so super fun stuff. Good luck to all you couples out there going through the exact same thing.
All right. Good luck to us.
Yeah, all you couples that get to have sex and have a baby suck. Just kidding.